Hi, welcome back to Rohrich Knows Podcast, helping you become a better you. And I don't know anybody who helps you become better you than Dr. Tony Youn, who is like a world famous plastic surgeon, but he's actually the most popular, and he's a real plastic surgeon on all of social media, from TikTok to YouTube to everywhere. So Tony, welcome.
Thank you so much for having me. This will be fun. Let's do it.
So we're going to do rapid fire on hot trends in cosmetic surgery or not. So I'm just going to give you some thoughts about what do you think is hot and not, and I'm just going to give you some thoughts on, and you can say yes, no, and then we may have a short rebuttal. We'll just move on. So, Tony, rejuvenation.
Ooh, I think if you're talking about injections to try to slow down or to not age initially, that I'm not a big fan of it. Usually rejuvenation, you're talking about Botox in people who are younger who don't have wrinkles.
Right.
And for me, I have seen people where you do Botox long enough and you get antibodies to it and you get resistance to it. Right. And why would you, I guess, do that so early that when you actually need it, it doesn't work anymore? I mean, hopefully we have something better, 10, 20, 30 years from now, but that would be my main worry with it.
I agree. And no science on it. Lip lifts. Everybody's been doing lip lifts.
So I'm a fan of lip lifts in the right patient. My concern is if somebody is really young, that scar of the lip lift can be visible. It can potentially thicken. I think it's great for people who are older, but I've always cautioned people, if you're under the age of 50, then you really have to have a great surgeon who does it. Somebody like Dr. Rohrich. Just be very careful because that is a visible scar and it's right on the front of your face.
Exactly. I think it's great adjunct in facial rejuvenation surgery, but not in a 20-year-old. We see it all the time. It's crazy.
Yeah.
Red light therapy. I know it's in your book and you've been talking about it.
There have actually been studies that have taken a sham laser on one side of the face and red light therapy on the other side and have found an improvement, even in as little as 1 month, in the collagen and the elastin in the skin afterwards. So I'm a big fan of red light therapy. It's not as powerful as getting a fractional laser or some of the things we do in the office. But for those people who are sitting at home, they don't, let's say, have access to a med spa or a doctor's office, this is a great way to fight the aging process at home, very simply and relatively affordably.
Yep, I agree. I actually got one because of Tony. Okay, so, the craze on deep plane facelifts.
So this is interesting because I get people asking all the time. I don't do deep plane facelifts, but I'm a more conservative surgeon. I think if you are looking at getting the absolute best, longest lasting result in a facelift, then yes, a deep plane may be the way to go. But the issue with deep plane lifts, and I'm a big fan of the work that you do and how you've done some of the techniques that you have. The problem with a deep plane lift is that if you've got somebody who's not doing it very often, or they're not all that well trained in it, it can be more dangerous than, let's say, a traditional SMAS plication or the SMAS window, the types of procedures that, that I've read that you've done, that I do myself as well. So yes, in the right hands, no in the wrong hands.
I agree. And also, the deep plane is not necessarily a new procedure. It's been in just a long time. Dr. Hammer and others described it. So it's not new, but it's a hot time. So, okay, what about long-lasting Botox or neuromodulators?
So there's a new one called Daxxify. It's been in the testing process for a long time. We've had it in our office now for almost a year. And I do think that it does last longer in most patients, but not in everybody. And we haven't quite figured out why or who it doesn't last as long in. So I think in general, yes, I get patients of mine who complain that my Botox doesn't last long enough. If that's the case, go for the Daxxify. But if you're happy with Botox, you may get a month or two, at the most 3 more out of Daxxify, but it's also more expensive. So we haven't seen as much uptake with it as I would have expected when it first came out.
Yep. Yeah, I agree. And there's like 3 or 4 new ones coming out this year. So it'll be interesting. See,
very exciting.
The struggle continues. Okay, let's shift channels to anti-aging. You're an anti-aging expert. So what about NAD and nicotine amide stuff? Is that really, I know Sinclair talks about that. Is that like the end-all, do-all?
So these are very interesting. The problem with NAD, and you can actually take it as NMN, it's just a different form, is that there is no science in humans that it's going to increase your longevity. The belief is that it might. There are people who are called biohackers, and basically what they do is they're the first people who try these types of experimental things. They're also the same people who are taking, let's say, metformin. They don't have type 2 diabetes, but they're taking it as a longevity medication. The thing you have to keep in mind with any of these is that the same things that may prolong your life, potentially longevity-wise, you have to make sure that they do not increase your risk of cancer. Because cancer is kind of like the same thing, where you cause your cells to last longer, they divide maybe more, but you don't want to, cause your body to have that type of a reaction. So NAD, NMN, they're kind of like the same thing. I think they're experimental. I'd like to see a little more data before I recommend that for everybody.
Yeah, I agree. And then metformin, it's been used for years in pre-diabetics,
Yeah.
and I have friends that take it, and I'm going, really, it stabilizes your mitochondrial membranes, but does it do more than that?
And I don't know. Honestly, I haven't seen a lot. I think it's still like NAD. It's still in an experimental type of thing as far as longevity. I think for people who want to try it, then that's up to you. But you will, with metformin, have to get a prescription from your doctor. Whereas NAD is a supplement that you can buy a lot of different places.
And okay, so what about rapamycin? That's kind of also a prescription drug. I guess they found it at Easter Islands, right? And
yeah, rapamycin's fascinating because there's this volcano on Easter Island that's on one side of the island. I actually visited it a couple years ago. And way deep in this volcano is this kind of marshy area that they discovered rapamycin. And rapamycin, just like you said, it's an immune modulator that's used in people who have transplant surgeries. But we're also finding that it is very closely connected to mTOR, which is basically the mammalian target of rapamycin is the name of it. And this is really kind of hot stuff in the anti-aging realm. It's hard to say. I think the problem with rapamycin, same thing that I worry about, when I mentioned earlier, is cancer. And like, what are some of the side effects of it? What are some of the long-term effects of it? At this point, it's more interesting. It's experimental. But once again, not something that I would say, hey, let me write you a prescription for it. I definitely want to see more data and human type of a data with rapamycin before thinking about that as a true longevity medication.
I agree. And we talked a little bit more about, what about resveratrol? I mean, it's it's in wine, but
yeah,
you have to have so much of it, right?
Yeah, so resveratrol, I think, is a different thing. And I'm definitely a fan of resveratrol. Now, I don't drink a lot. I'll have a glass of red wine here or there. There are some beliefs that having a glass of red wine a day is very reasonable. And I think in general it is, mainly because of the resveratrol, because it's such a powerful antioxidant. So I'm all for resveratrol. You just don't want to drink more than a glass of wine a day, because then the toxic effects of the alcohol they kind of take over. So yeah, unlike some of the other ones we mentioned, I think resveratrol, I would give a thumbs up in general. But if you take resveratrol, are you going to live longer than everybody else? That we don't know. I think that it's a great antioxidant, like a vitamin C.
Yep. And CoQ10, you're a fan of CoQ10?
Same thing. Yeah, that too, I think is fine. You can easily find that in supplements. And once again, it being a good kind of anti-inflammatory, antioxidant type thing, I think is great.
Okay. So, what about the hot skincare things on exosomes, the precursors to stem cells? And that's really become more and more science-based out there. Skincare is coming out. What do you think of that?
So that's still in its infancy. It's very interesting. When we look at exosomes, you always have to include peptides into the discussion. So peptides basically are small chains of proteins. They basically they're like cellular messengers. They send messages to your cells, let's say of the skin, to create more collagen. That's all they technically do. So when you see peptides in skincare, that's what they do. They message your cells to create more collagen. The idea behind exosomes is that they're basically like vesicles. They're like pods where you can send cellular messages to parts of your body more than just to increase collagen. And so you can get exosomes in, let's say, skincare that is people will apply, let's say, after treatments to help soothe the skin. You can have ones that ideally can help to increase collagen. And the idea is that you can send different types of messages through these exosomes. It's not just limited to what you see with peptides. So it's exciting, but it's still very early. And it's definitely related with the whole stem cell phenomenon. And so now you've got to consider, FDA regulation and all that too.
Right. And there's some more studies coming out. In fact, there's some that actually is uniformly coming from platelet-derived exosomes, which actually has more science, but some of them just, they get exosomes from, we don't know where. So it's,
yeah.
It's kind of
yeah, it's exciting. I think we're going to hear a lot more of it over the next few years. I think that's the next big thing. But right now, I do still believe it's kind of in its infancy.
Okay, so let's talk a little bit about, surgery. There's mini lifts, mini tummy tucks, mini. I mean, I personally think that anytime you talk about mini, I don't even know what that is sometimes when you talk about a mini facelift. So what do you think about that when people want to kind of say, and to me, that's more of a marketing thing.
Yeah. Mini in general, mini lifts, mini procedures equals mini results. And that's what I tell my patients, if you do a mini tummy tuck, I think it's a reasonable procedure, but you get many results. And, early in my practice, Rod, when I first started, I'd have patients who come in and they're a candidate for a traditional tummy tuck.
Right.
They go, no, I want a mini. So then as a young surgeon, I'm like, okay, I'll do what my patient wants. And then afterwards they're disappointed because they had a mini, but they wanted a maximum results.
Okay.
So now I just tell them, look, if you want a mini, I go, do you want mini results? Are you okay with mini results? And if their answer is yes, I just want a small change, then sometimes it can work. And it's the same thing whether you're talking about facelifts. And now there's even companies like there's Air Sculpt that is for liposuction. And it's like, oh, we use a tiny little cannula. Come on, it's liposuction.
Exactly.
It's the same thing, you know? And so it's marketing. And I think that unfortunately there are companies that will market their products and their services. It started with a lifestyle lift long ago and it continues on. These are fly-by-night companies that make up fancy terms. They make a bunch of money for a couple of years and then they disappear because people realize that it's all BS and it doesn't really do anything that we wouldn't do anyway.
I agree. So let's talk about things we shouldn't do. I mean, obviously one of those is tread lifts. I can't stand it. I take out so many of those when I do facelifts. I mean, what do you think of that? What do you think of things like that?
So you and I were in practice when the first group of thread lifts came out back in 2003, 2004.
Yes.
Those were permanent sutures and you're like, oh my gosh, they run it under the skin and look at how much the skin's being lifted and it's a non-surgical facelift, non-surgical brow lift. And the problem is that, yes, you can run a barbed suture under your skin and see an immediate change to it. But as you and I both know, you're not altering the actual anatomy of the face. The facial anatomy cannot be altered by pulling a suture through it. Right. And so 3 months, 6 months later, everything cheese wires through and you're back to where you started. But back then, now you got these sutures sticking out of your face 3 years later because they're permanent sutures. So they went by the wayside for many years, and then a new crop of surgeons comes around. And unlike you and I, they weren't maybe around back in 03, 04, and they're like, look at this great new invention of thread lifts. I've never seen it before. Let's do this on people. This is amazing. And they're seeing the results are the same, but the good thing, at least these sutures are absorbable. So I don't think that they're as concerning as they were before. I think the big thing that I tell my followers and my patients is to make sure that if you have it done, just realize that you may be spending $3,000, $4,000, $5,000, $6,000 on a 6-month result. And if you're okay with that, you've got the money to spend and you want to that's fine, go ahead. Just and it's important for practitioners to be honest with their patients with this. And that's what gets me is when the practitioners don't tell them this and they spend all this money and now they've got these threads and their results are gone.
Right. And then we have to live with them when we have to do real surgery, So it's great. So,
yeah.
And I always love what you do on TikTok and on YouTube about talking about extreme plastic surgery. And you're very, very kind and gentle because you say, and again, these are things that some people elect to do, but it's really dangerous, isn't it? Often, and you go, why? How did that happen? I mean. So how do you explain that? And of course, it seems like it's rampant around the world, and we're seeing that extreme plastic surgery being done in certain countries like Korea. And you go, why is that happening?
Yeah, I think like anything in our field, you've always been a voice of reason. That's why I have always really enjoyed, reading your articles. And I think that unfortunately, when you're in a field, a couple of things. The first thing is that you're in a field where we make money based off of every procedure we do. And there are some people in our field who don't focus on what's best for the patient, but really what's best for the pocketbook. Right. Your consultations and mine are consultations where we sit down with our patients and we talk about the risks and the benefits, and we try to figure out what is best for that patient together. But we also know that there are surgeons where their consultation is, what do you want and how much does it cost? And they'll do anything that people ask them to. And that's just not being a good physician. So I think that's the first thing. I think the second thing you see in social media, especially, is people want to go viral. They want the clout, they want the attention. And so what do? They do increasingly more extreme things, because you act extreme on social media, you gain a following from it. And that's where I think there are even some, I think, good doctors who shockingly have, you find like, wow, what are you doing? Like, you're doing things to people and you're dancing in the operating room and stuff like that. I mean, it's tough, because always, and I do goofy stuff on social media, but it's never at the expense of a patient. Right. And it's never, ever when I'm operating on somebody or treating somebody, ever. You'll see me, we show surgery sometimes, but I would never do like a live stream or I'm answering questions while I'm operating on somebody. Like, there is a definite line that you draw there. And it's number one, you never, ever compromise a patient. You always have to have the patient's best interest in mind. And that has to be the big thing. And then number two, you don't, let kind of the desire for likes and followers and all that to take over what always has to be that number one.
Right. Don't do crazy stuff. Always take care of the patient first. That's what we are. We're physicians first, not plastic surgeons. Do no harm. I know. Great.
Exactly.
Yeah. Wise words. A wise surgeon and a wonderful, wonderful individual. Tony, it's always a pleasure talking to you and chatting.
That was a lot of fun.
And it's great to have you as a colleague, as a plastic surgeon. It's an honor to have you with us. So thank you so much for taking the time, and give us your thoughts and comments about Dr. Youn, and also the incredible hot topics that we talked about. I mean, I agree with everything he said about all the things. Are just be safe. Don't do crazy stuff. Don't do things that you wouldn't do to your family members, and just enjoy life. So, okay, thank you so much again, Tony, and it's a pleasure having you on Rohrich Knows podcast.
Thank you so much. Appreciate it.
All right, take care. Yeah.